Tianjiu is a special expert at the hospital. She handles the tough cases that no other department can solve. She's not just super smart, she also loves digging into weird mysteries outside the hospital. Basically, she's a real-life Doctor House. Illnesses and strange crimes that seem totally unrelated. Under her reasoning, they slowly reveal breathtaking truths. One day, the ER gets two tricky patients. The first is a kid with nausea, body pain, and blurry vision. All his test results come back normal, but no one can figure out what's wrong. The second is a middle-aged guy with terrible stomach pain. Before his CT scan comes back, it's hard to tell if it's appendicitis or just gastroenteritis. But for Tianjiu, these problems are a piece of cake. She quickly checks the kid's chart. Then she carefully examines his eyeballs. And she figures it out right away. The kid has hypervitaminosis, too many vitamins. Turns out, she noticed when she first walked in. The kid's mom was carrying a bottle of vitamin supplements. If you take too many vitamins, they build up in your body. That can cause full body pain, weird changes to lips and skin, and even increased pressure inside the skull. That's why the kid had those symptoms. Stop the vitamins, and he'll get better almost immediately. As for the middle-aged guy, he ate raw sardines from a fishing trip. That gave him a parasitic infection in his stomach. All he needs is a GI specialist to do an endoscopic removal. Another doctor asks Tianjiu how she figured it out. She says, I worked backward from what I saw in the symptoms. Just looking at his chart, she already knew it wasn't appendicitis or gastroenteritis. Judging by how tan his face is, he probably wears a hat a lot. And even though he's not that old, he uses a cane. That tells her he spends long hours outdoors. Then there's a small wound at the base of his left index finger. That's a common spot for injuries when you're removing a fish hook from a fish. So she figured he goes saltwater fishing. And he got hungry, so he ate what he just caught. Fresh raw fish, the parasites burrowed into his stomach wall. That caused the intense abdominal pain. In just a few minutes, Tianjiu solved both cases. She showed off her incredible medical skills. Right then, Xiaonyao gets an emergency call. A critical patient is being rushed to the hospital. The patient's left leg is severed just below the knee. He's barely breathing and has almost no pulse. And get this, his blood is blue. A leg that looks like it was torn off by a giant beast. And that rare blue blood. Tianjiu is instantly fascinated. She's a doctor, but her real passion is playing detective. Officer Naruse, however, doesn't want to share any info. He thinks a simple autopsy will reveal everything. The hospital director also tells Tianjiu to stay out of it, but she's not the type to listen. She asks Xiaonyao to go with her on her day off. They head to where the attack happened. Near the scene, they see a bunch of unfriendly-looking guys in suits. And then Tianjiu spots Officer Naruse with Detective Sakurai, the guy who handles murder cases. That's when she knows this is a homicide. With Detective Sakurai's okay, Tianjiu and the others head into the park. She tells everyone that the real first crime scene isn't here. It's the museum, which reopens tomorrow. And the giant carnivore that bit off the man's leg? A Tyrannosaurus Rex from that very museum.